Hi everybody, my name is Tania Cork and I'm going to talk to you today about health literacy and its role that it plays in medicines. So today we're going to look at an introduction of what health literacy is and what limited health literacy is. We're going to have a little bit of an understanding about the general literacy and numeracy levels in the UK, and then we're going to make links between that and patients being able to take their medicines correctly. So what actually is health literacy? Well, when we talk about literacy in the context of health, it is called health literacy. And health literacy, as it says on the slide here, is the degree to which an individual has the capacity to be able to obtain, process and understand basic health information and the services that are needed to make appropriate health decisions. So the key words here are that the patient needs to be able to obtain that information, be able to process it and understand it. So the other definition that we have on the slide is to do with medicines. So it's very similar to the first definition because it talks about being able to obtain the information, being able to comprehend it, being able to communicate though, that's a new part of this definition. So we would expect patients in a health setting, whether they're going to see the pharmacist, the doctor, the nurse, to be able to communicate and articulate what is the matter with them, whether that's a health problem or whether they're getting side effects from any medicines. Also in this definition, you will see that it says calculate. A lot of medicines, they would need to have to calculate the dose. We have some medicines where you may need to start off on a small dose and then increase the dose. So the patient would need to calculate how much medicine they need to take. So therefore a patient would need to obtain, comprehend, be able to communicate, calculate, process the information, read information around the medicines to be able to give them an informed decision of whether they want to continue to take their medicines and whether they're going to adhere to them. And also those things are needed for a patient to be able to safely take their medicines and take them correctly. So now let's look at limited health literacy. There is a huge amount of health information out there for patients, whether they're collecting a leaflet from the GPs or from the pharmacy, or whether they're looking at it on the internet. There is so much information out there. And a lot of that information can be very confusing. And we do know that there is a big mismatch between the information out there and the reading and numeracy levels of adults within the UK. So a lot of people will be able to obtain this information because it's out there, but do they actually understand it? Can they make sense of it? So we do know that patients with poor or limited health literacy have a difficulty to be able to process and understand the information to allow them to make decisions about their health and their medicines. So why is health literacy important in medicine taking? Well, we know medicines are widely used for many conditions, not only to relieve the symptoms and cure the condition, but actually to prevent ill health in the future. However, we do know that research consistently shows that approximately 50% of patients do not take their medicines as they are prescribed or how they are instructed to take their medicines. Because of this, hospital admissions are very high because of the adverse effects of medicines, what patients take. So medicine taking is very complex for the patient to understand. This is further escalated if the patient has poor health literacy. They are going to have further problems being able to understand their medicines and take them correctly. So what sort of skills does a patient need to be able to obtain their medicines and take them correctly? Well, here's a few on the slide here. It's certainly not exhaustive. So we talked a little bit before about understanding medicines correct doses. So the patient would need to be able to read and understand the information on the label. And some of the labels have a lot of information on there by the time they put the dose and the warning or cautionary section on the label. So the warning and the cautionary might be about take with food or take on an empty stomach. So patients will also need to read the information leaflet that's inside the pack, and again there is a lot of information on there that the patients may not understand or actually may not need, but the manufacturers have to put that information on there. We've talked about the internet, and patients can get information off the internet, and they may need to read articles about prescription medicines or over-the-counter medicines. Those are the medicines that they can come in and buy. And those websites and internet information can be very confusing because there's a huge amount of information out there from different websites for different medicines. If we look a little bit further down the list, the patients need to be able to ask for clarification from their GP, pharmacist, nurse if they don't understand it. They may need to ask questions, and therefore they've got to be able to articulate what they want to know. And then finally, if we look at the patients and consent, a lot of patients need to give consent for treatments, even something simple like a flu vaccine. The patient's got to give consent. But do they actually understand what is being asked of them for the consent and what they are consenting to? So we said right at the very beginning that we were briefly going to look at the literacy and the numeracy problems within the UK. So here that you can see I've put on the slide, the majority of working adults in the UK have a reading age of 11 to 14. When we look at numeracy, so we're adding in calculations and anything to do with numbers, the majority of working adults in England have a capacity of the age of 9 when it comes to numeracy. So what does this actually mean then? So we know that there is a big mismatch between the skills of working adults in the UK compared to the health material that is out there. And we do know from studies then that has shown that 42% of working adults in the UK are unable to comprehend basic health information. We also know that that increases to 61% when we talk about the numeracy skills that are needed from our adult population. So what is the impact of a patient with poor health literacy? What's the impact of that on medicines? Well, again, I've listed some here on the slide. It's not exhaustive. So we have medicines adherence issues. So patients do not adhere to the instructions they've been told. They may take it in the morning rather than night. So very simple things like that. They may not understand what 1-3 times a day on an empty stomach. If they've got to take it with breakfast but they don't have breakfast, do they actually still take that dose? And that may seem quite simple to you and I, but patients may not understand this information. We have a lot of medicines that we use, things like creams, eye drops, inhalers. Do they actually know how to use an inhaler properly? If we look at the pharmacy environment, patients come in and buy medicines. They're told how to use them correctly when they buy them, but there is a lot of medicines that can just be picked up off a counter, off the shelf, so from supermarkets, etc., petrol pumps. They can just be picked up and sold to the general population. Do they understand how to take that medicine? Can they take that medicine with something that they're already taking from the GP? So those sort of things that if a patient with limited health literacy may struggle to understand or may struggle to ask the question about what they can do with the product that they're buying alongside a medicine that they're taking off a prescription. So the impact we tend to see with patients is that they can overdose. We don't have to explain that. It can be quite serious if the patient overdoses. But patients can underdose as well. So if they underdose with their painkillers, they're not going to get pain relief. If they underdose with epileptic medicines, they may have problems then with having epileptic seizures. So underdosing is as bad as overdosing. And patients tend to do this if they have limited health literacy and don't understand how to take their medicines. So if we look at an example here, a typical label that would say take 2 tablets by mouth twice a day. How many patients would understand what that means? And don't forget, we may add some cautionary labels on that as well, something like take on an empty stomach, do not take milk at the same time, or any iron preparations. So there may be more on that label than what is actually shown on this slide. We do know from studies that 1 in 3 patients with limited health literacy could not correctly demonstrate how many pills to take during the day. So they may be able to read, take 2 tablets by mouth twice a day, but when they had to demonstrate by taking the tablets out of the bottle and when to take them and how many would be taken during a 24-hour period, they could not demonstrate that. And this shows that even though we're putting labels on medicines, it seems quite simple to some people. People with limited health literacy may not understand it. Wouldn't it be nice actually to see a label like this? Take 2 tablets at 8 a.m. and 2 tablets at 8 p.m. It would also be nice to see perhaps a picture on the label that corresponds to morning and night. However, this comes with problems itself. We've said before that patients that don't have breakfast might not want to take their tablets then at breakfast time. So the 2 at 8 a.m, they may not be up at 8 a.m. out of bed, so they'll miss that tablet. Or take it at 1 o'clock and take the next dose at 8 o'clock, which is actually too close together. When we look at pictures, again, they need to be pictures that are understood by every culture within the UK, and that is not easy to do. Okay, so as a summary then today, what we've looked at is what health literacy actually is. We've described it and given you some definitions. We've also looked about what the general literacy and numeracy levels are in the UK, and we've made some links between limited or poor health literacy and how that impacts on medicines. For those that are interested in doing more reading around this topic of health literacy in medicines, I've put some further reading on here and some of the studies that I've discussed during the PowerPoint.